2015 meeting of the Human Service Committee now comes to order. Madam Clerk, could you please call roll?
Ms. Andrews? Dr. Carbone?
Here.
Chairman Colby?
Here.
Mr. Delahanty?
Here.
Mrs. Draw? Here. Mr. Gamina? Here. Ms. Cayley? Here. Mr. Lightfoot? Here. Dr. Quattro?
Here.
Is there anyone signed up for public forum?
There's not.
Is there one? Yes. Sure. Is there anyone present that would like to address this committee at this time? Seeing none, the next item on the agenda is approval of the minutes. You have the December 16th minutes of 2014 before you. They will stand approved unless the clerk is notified of any changes by the end of the day. Before we start new business, the food of the month is something that's grown a lot in my district. Garlic. There's a lot of garlic grown in western Monroe County and Orleans County. It's good for you. If you guys got colds lately, you should be eating more garlic. So, it's good seasoning. Okay? With that, I'll move on. The next item is new business. Madam Clerk.
Referral 15-0016.
Moved by Legislator Cabone, second by Legislator Quattro. Any questions? Legislator Lightfoot.
Thank you, Mr. Chairman. My question, the amount being appropriated, $30,000, is this money part of the $100,000 or an additional grant?
Through the chairman to the board.
Through the chair, this is part of the 100,000.
Okay, thank you. And Mr. Chairman, through you, where was the money originally appropriated?
Through the chair, it wasn't, and this is a multi-year, I guess maybe even grant that covers, 5 years. And we've had, some of the other appropriations for the first 2 years. Currently tonight, this is for the additional amount, from that original 100,000.
Okay,
Through the chair.
Thank you. And through you, Chairman, to the administration, how many flu shots were administered last year? Through you, Mr. Chairman.
Through the chair, this was our first, I guess maybe season, that we did the administration of the vaccines back in November, and we delivered somewhere in the ballpark about 800 influenza vaccines to school-age children.
Through you, Mr. Chairman, to the administration, news reports show that I think we had 8 deaths in our area from flu-related. Some of them were children. I just wonder if it's also asked or studied whether or not out of the 8, did those people receive flu shots?
Through the chair, we can't comment specifically about individual maybe cases just because of reasons regarding HIPAA. But what we can tell you is that for school-age children, roughly you only have about 50% of those that are getting their influenza vaccine annually. That's age appropriate.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item.
Referral 15-0017.
Moved by Legislator Quattro, second by Legislator Gamina. Legislator Cayley.
Thank you, Mr. Chairman. Through you to the administration, since this is the first year for this particular grant, could it be explained if this is going to be, services are going to be delivered any differently than are already being done with Nurse Family Partnership, or is this a totally new program?
Through the chair, this is a different program. This is a different program, and there is, some overlap with regards to like maybe scope in terms of who is being targeted. But essentially, this supplements, work that targets, if you will, like low-income, pregnant moms, but also I guess moms who have infants as well. Not just with Nurse Family Partnership Program, but also other programs that we administer, including WIC.
All right, thank you. And with regards to the wording saying peer counseling, could you explain what that will mean to the program through the administration?
Through the chair, the peer counseling, I guess maybe piece, includes, individuals, who undergo, training and various things, including helping moms, and encouraging them to undergo the initiation, but also the duration as long as possible of breastfeeding. But also with regards to certain things related to nutrition of not only themselves during their pregnancy, but also their infants during early childhood.
Okay, thank you. And to the administration, through the chair, are we speaking specifically then of training of just, I don't mean to say just staff, but when I read peer-to-peer training, I think of someone that may not be on staff. Are we looking at training current staff members to do this outreach?
Through the chair, that includes not only efforts that involve, county staff, but also folks who are not part of the county as well. Some of the efforts, in addition to some of the peer counseling, including for lactation, include educational efforts, and so some of those educational efforts include having folks, who visit some of the OBGYN offices as well as some of the family medicine practices with regards to the same educational messages, many of which are not entirely maybe unique maybe to this program because, as I mentioned earlier, there is some overlap between these and other programs.
Okay, thank you. And then in terms of, through the chair to the administration, in terms of the outreach, as you said, there would be some overlap between the Nurse Family Partnership and this particular program. Would this program's, I think, added benefit be in that it would reach some of the mothers out there that will not be served by Nurse Family Partnership just because of the amount of funds that we have?
Through the chair, that is correct.
Thank you. And would this, one last question, how exactly, through the chair to the administration, how will we or how will you identify the mothers and children that may be impacted by this, and would that be in-home visitation or not?
Through the chair, that includes not only contacts that we may have with certain, potential eligible individuals, but also it includes maybe referrals in the same way that includes some of our services we deliver through Nurse Family Partnership Program and WIC. Oftentimes, some of the folks that we provide services to have been referred to us by other agencies. That can include community providers, but just maybe other community organizations as well.
Okay, thank you very much.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item, please.
Referral 15-0018.
Moved by Legislator Gamita, second by Legislator Draw. Legislator Lightfoot.
Thank you, Mr. Chairman. When I'm reading this in the second paragraph, I see that this contract will support the county NFPA program. The NFPA program provides home visits to high-risk first-time mothers. Anytime I see that word high risk, it makes me wonder, what does that mean in this context of this particular contract? So through you, Mr. Chairman, to the administration, how are these mothers being reached, or how are they identifying the mothers? Through you, Mr. Chairman, to the administration.
Through the chair, part of that high risk definition includes, a number of factors, including their Medicaid eligibility. And so when you have, moms maybe who are first time, but also moms who must be identified by 28 weeks gestation, those are some of the core, if you will, program requirements, in addition to being high risk. And again, nationwide, they use Medicaid as a basic definition for that, but it includes other areas as well. And so in some cases, the number of folks who are eligible may be broad, and then in terms of folks that you may need to triage, still get to them, but you're prioritizing who you see first. As an example, we've had situations where we have like a 12-year-old who may be pregnant, but we also might have, but that 12-year-old may have a lot of social support, including a mother, including an aunt, grandparents. We may also have another individual, let's say, who's 25-year-old, who's pregnant, eligible for the program, and she may have no support whatsoever, including other family members or other friends to support them. So those would be added examples, if you will, being high risk just because of that lack of social support, even though they meet the other eligibility criteria, including being first-time moms and being Medicaid eligible.
Okay, thank you. And to follow up with the NFP, or the Nurse Family Partnership, through you, Mr. Chairman, to the administration, how long have the Nurse Family Partnership been providing this service? Through you, Mr. Chairman.
Through through the chair, we've been providing this program since the mid-2000s. We were one of the first, communities in New York State to actually offer this program, and over time, it has expanded not only in the state of New York but also nationwide. Some of the original research that was done to support Nurse Family Partnership Program in terms of the evidence was developed in upstate New York, some of which included some results that were published back in a medical journal article the latter part of last year, showing some of the benefits.
Great, thank you.
Any other questions? Seeing none, all those in favor say aye. Aye. Those opposed? Motion carried. Next item.
Referral 15-0019.
Moved by legislator Draw, second by legislator Delahanty. Legislator Keeley.
Thank you very much, Mr. Chairman. Through you to the administration, I'm looking at the number of cases on this particular referral for Chemung and Ontario County, and could you tell me how you arrived at this number?
Through the chair, in terms of maybe the number of cases that are served by a county, we have historical information that kind of shows what the number of cases that they typically get in a given year. And not only do we have historical information about the total number, but also the distribution, and that factors into, if you will, the contract. So for example, our medical examiner's office, there are generally 3 types of cases that they will see. There are ones that require full autopsy, there are others that require partial autopsies, and then there are a third category that require just the external examinations. Each of those require a different level of effort, with full autopsies requiring the most. And so in addition to that total volume that we have and that we know historically for a county, we sort of know what the distribution is, and so for that, we're able to, if you will, identify an appropriate contract based upon the historical data.
Thank you. And through the chair to the administration, are there other counties that were performing these services while they wouldn't necessarily be on this referral? Do we do the same work for other counties?
Through the chair, that is correct. We roughly provide service to about 10 counties.
Thank you. And just, if at all possible or at a later date, could, through the chair to the administration, could we get an idea of the revenue that's generated by the excluded services that's billed separately?
Through the chair, I'm not sure if I understand maybe your question.
Well, if I may, excluded services as well as cases referred over the fixed number of agreed cases are billed to the referring county separately. Fixed rates will be adjusted if extensions are accepted. I read that to understand that there's a separate billing based on excluded services. Am I correct?
Through the chair, that is correct, and in part, since this is the first year that we have implemented this, this rollout completely, we don't necessarily have that historical information with regards to what that looks like. So as we are generating, if you will, maybe that data, we'd be happy to sort of share that.
Great, thank you very much.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item, please.
Referral 15-0020, authorization.
Moved by legislator Delahanty, second by legislator Carbone. Any questions? Legislator Draw. Could you move the mic up further to get it on the record, please?
Through you, Mr. Chairman, to the administration. Why is there such a substantial increase from last year in this contract?
Through the chair, there was additional money from New York State Office for the Aging for Community Services for the Elderly, which was incorporated into last year's programming and will be also incorporated in 2015.
could the person that was speaking identify who they were? since
Oh,
I don't
yes,
know?
through the chair, I'm Steve Newcomb, Monroe County Office for the Aging.
Thank you. I didn't recognize.
Apologize.
Any other questions? Legislator Kaley.
Thank you, Mr. Chairman. Not really a question, but just a statement. I'm a frequent visitor to the Charles Settlement House, which has an excellent senior program, and I can say that this is a welcome increase at a time where historically their services have continued to be extraordinary, but less money every year. So I do appreciate this coming through.
Through the chair, I thank you, and I will pass that that comment on to the folks over at Charles Settlement.
Thank you.
Any other questions? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carried. Next item.
Referral 15-0021.
Moved by Legislator Carbone, second by Legislator Quattro. Any questions? Legislator Lightfoot.
Okay, thank you, Mr. Chairman. My first question is the grant for $1,101,831, and this is 33rd year receiving it. How many people received heat payments last year through you, Mr. Chairman, to the administration?
Mr. Chairman, although that is although that information is not readily available tonight, it is a report that we have run in the past and would be happy to share again.
So I barely could hear because he wasn't on the mic, but what I think I heard, Mr. Chairman, is that it's not really available tonight.
It's not readily available
but he's gonna
tonight,
provide
but he
it.
has it available in a routine report that he put out quarterly.
Mr. Chairman, it would be an annual report that has been run in the past and we can run again.
Okay, and when reading this referral through you, Mr. Chairman, to the administration, what is unusual payment through you, Mr. Chairman?
Mr. Chairman, I think I can answer that question, but can you direct me to the particular paragraph where that statement is made?
I'm sorry, I'm just moving on. Give me 1 second here. Second paragraph.
Mr. Chairman, I believe the reference is New York State began processing most regular heat payments. Other payments that would be managed by Monroe County would include expenses associated with two-party checks or expenses related to furnace repair or replacement.
Okay, and through you, Mr. Chairman, to the administration, this referral, is it going to cause us to amend our 2014 budget at all? Through you, Mr. Chairman, to the administration.
Mr. Chairman, this particular referral actually amends the 2014 operating grant budget, and the unencumbered balances will roll into 2015. To be clear, this is a program that historically has multiple allocations over the heating period. I would imagine that this body would receive referrals for additional funding perhaps 2 or 3 more times this heating season.
And could you just explain to me again why that is, through you, Mr. Chairman, to the administration? Is it just the cost of the heating and cannot be predicted year by year based on weather, I guess, through you, Mr. Chairman, to the administration?
Mr. Chairman, that's an excellent question, actually. In the past, it has been discussed that multiple referrals come to each of the counties because of the wide variation in severity of weather conditions and the cost of utilities and variations in receipts from the federal government to New York State for this program.
Gotcha. Okay. Thank you.
Legislator Kaley.
Briefly, through the chairman, to the administration, has there been a period of time in season that we have not been accepting applications? I'm assuming with this funding coming in that will be taken in service at this point, but I'm not sure if it was ongoing.
Mr. Chairman, we will confirm before a final vote is taken, but given that the heating season only opened in November, there should not have been any time to date where applications were not accepted.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item, Madam Chair.
Referral 15-0022.
Moved by legislator Quattro, second by legislator Gamina. Any questions? Legislator Keeley.
Thank you very much, Mr. Chairman. Through you to the administration. This is the fourth year, but unfortunately, the funding has gone down. And can you speak to why the funding has gone down? Is it a state budgeting issue? Or I realize that Hillside and the foundation is supposed to provide 50% funding prior to making the state award. Does that affect, two-part question, does that affect how the funding is distributed?
Mr. Chairman, funding is reduced based on allocations made by New York State to the various participating counties. That allocation is determined for Monroe County, not just on Monroe County spending, but on Monroe County spending relative to the other counties' approved programs. So it is not a perfect math formula, nor is it something that could always accurately be determined.
Thank you. Then, jumping off of that one, I'd have to ask, do you know at all if other counties have been reduced as well? Through the chair, I'm sorry.
Mr. Chairman, we do not know at this time. That's something we would look into and report back before the full legislative meeting.
Thank you. And then realizing that you're not, through the chair, you're not in charge of the program or its performance, do we anticipate that this amount is going to cause a great dent in the amount of services that can be given?
Mr. Chairman, in all honesty, I would suggest the answer is no, given that the funding period has long come and gone. It follows the federal fiscal year that completed on September 30th.
Then if I understand correctly through the chair, their expectation was it was going to be lowered.
Mr. Chairman, the expectation, the prior expectation when the program was running was that it would have been funded at the same amount as the prior year, and I'm confident that services were arranged and delivered concurrent with that belief, and is unfortunate that this allocation came in below that expectation.
Thank you. And then, not expecting it now, but perhaps through the chair to the administration, could we get a number of how many children over the past 12 months have been served by this program?
Mr. Chairman, that information can be provided by the legislative meeting.
Thank you very much.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item.
Referral 15-0042.
Moved by legislator Gamina, second by legislator Draw. Are there any questions? Legislator Lightfoot.
Oh, thank you, Mr. Chairman. Being that we hear so much about our backlog, I'm glad to see that we're trying to do more things about it. Through you, Mr. Chairman, to the administration, I just want to ask, was Dr. Cantonese, was he the sole responder to the RFP? Through you, Mr. Chairman, to the administration?
Through the chair, yes, he was.
Okay. How long has the county been attempting to fill the 2 vacancies? Through you, Mr. Chairman, to the administration?
Through the chair, that's been since, the end of the fourth quarter of last year.
Okay. Thank you.
Any other questions? Seeing none, all those in favor say aye. Opposed, motion carried. There are no other matters to come before the meeting. Yes, Madam Kaylee.
It's all right, I'll be Madam Clerk, I don't care. Thank you, Mr. Chairman. I just was asked, since Ms. Carey, listen to me. Since Ms. Andrews couldn't make it to the meeting, she was en route, she will not be with us, but she had submitted a letter to you
Yes,
with regards to Ms. Reed visiting.
So I won't hold it open. She's excused according to the president, so I don't have to hold it open.
No, but
Oh.
this was about a letter to you that she had submitted requesting Ms. Reed's presence, and I just wondered if we could get an update on that could happen.
Yes.
Through you, Mr. Chairman. Commissioner Reed is out of town for the remainder of the week and was unavailable to attend this meeting. If you have any specific questions related to the subject matter of the letter, we'd be more than happy to forward those to her and get answers in writing.
All right, thank you. I will let Ms. Andrews know.
Thank you. There are no other matters to come before the January 25th of 2015, 27th, excuse me, of the 2015 meeting of Human Service Committee stands adjourned. The next meeting for Human Service Committee is scheduled for Tuesday, February 24th, 2015 at 6 p.m. Thank you.